You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest says no one should be wearing a loose-fitting denture. We're talking about the newest, hottest trend in dentistry, which is dental implants. With us, we have an expert on the topic, Dr. Giri Palani. Dr. Palani, welcome to the program.
Thank you for having me, Randy.
Good. Now, I know you brought some photos, so we'll get to those. Now, for people that don't know your practice, like, I guess you have a couple of practices. Who's your typical dental implant patient? And, what are the different services you offer?
So, Randy, there's typically two groups of people. The first group of people are the people who have, severe gum disease. They have loose teeth, painful teeth. They're at the dental office every week going through emergency procedures, and they're about to lose all their teeth and they're about to get a denture. These people know that they're going to lose their teeth, and they actually come to us because they don't want a denture.
Okay.
And the second group of people are the people who are already in dentures. And they've gone through the system, they've lost their teeth, and they have their denture, and they've kind of adapted to it. And they're living their life like that.
So no more dentures, we said at the top of the show. You don't think anybody should be wearing a loose-fitting denture?
Absolutely not. With the technology today, with the advancements in the procedures, we're able to give people a full set of teeth that they don't come in and out of their mouth. And we can do it all in one day.
Now, you're like a cosmetic dentist as well. Because when I look at your website and even the photos you brought, it's beautiful teeth. So you do a lot of cosmetic too.
Of course, yeah. It's part of the whole package. When you come to our office, you're going to get teeth that look like beautiful teeth. There's no way I can do a full mouth reconstruction on someone and not have it look amazing.
So what is full mouth reconstruction? What do you mean by that?
Full mouth reconstruction is, just like what we talked about. You have people who have lost their teeth or they're about to lose their teeth, and they come to us for help because they don't want to wear a denture. So we'll place anywhere between 4 to 6 dental implants, in the upper jaw and lower jaw, both sometimes, and we'll give them a full set of teeth.
Brand new teeth.
Brand new teeth.
They can eat whatever they want?
Beautiful porcelain teeth, zirconia teeth, teeth that look like real teeth, teeth that are going to function like real teeth. So this is what a full mouth reconstruction is.
So are there a lot of people, like where you are, that are wearing a denture?
Yeah, Randy, you'd be amazed. There are over 500,000 people that are already in dentures, and another 500,000 who are about to, or who are headed to getting a denture. Because
so if dental implants are so good, like you're getting like as you say, a brand new set of teeth, people can walk in. So you told me this on the phone. On the day of the procedure, they can walk in with no teeth and walk out with teeth the same day. Is that right?
That's absolutely right.
You call it what? Same day teeth, dental implants,
same day dental implants. Right. So, you're right. The person who's wearing their denture, they, in a way, that they're kind of relieved because they've gone through the root canals, they've gone through the loose teeth, they've gone through the abscesses and infections, and they got their teeth out. Mm-hmm. And they were given a denture on that day, and they hated it for about a week or 2 weeks, and somehow they just adapted, and they're just kind of, they've learned to live their life like that. And so in certain ways, they're relieved that they don't have to go back and forth to the dental office anymore. The problem is
why don't they all come in? If it's as good as you say it is, because you can eat and chew whatever you want.
They just haven't been informed. They haven't had the right.
Because they don't go to the dentist anymore.
Because they don't go to the dentist anymore. No one's really telling them about their options. No one's educating them about what's available. And they feel like they're just stuck with the denture, which is absolutely not the case. The other reason, Randy, is that they're just afraid of the dentist. They've been through so much pain, they've been through a lot of agony, they've spent a lot of money, and they just don't want to be at the dentist.
Now, getting this procedure done, pain is not something you say that they really complain about.
No, the pain is minimal, the downtime is minimal. I have a lot of patients, they come in on Monday afternoon, they get the procedure done, and they're back to work on Tuesday or Wednesday, they're back to work.
Is that right? How soon can you eat after you get your brand new set of teeth with dental implants?
A lot of times, right when the procedure's done, I'll hand my patient an apple just to
Really?
Yeah. I'll have them bite into an apple just so that they know that, this is something that's, I want to give them the confidence. I want to give them the excitement of, they're headed in the right direction with the procedure that they've done.
Now, look, I've had guys on this program. We've been, airing for 19 years, but they, even recently, they say, when you get dental implants, you got to wait like 3 months before you can really, like, bite an apple.
That's kind of the
Is
more...
that older technology or beliefs?
It's a little bit more of the traditional methodology of doing implants. In the olden days, it was, you had to extract the tooth. You wait 3 months. You do a bone graft. You wait another 6 months. You put the implant in. You wait another 6 months. So, by the time people were getting their teeth, it was, close to a year, a little bit over a year. And, it's actually still being done that way in a lot of places. But, there's so many new advancements that I've been trained in that we're able to use fewer implants. We don't have to do as much bone grafting as we thought was needed before. And we're able to do these procedures, give people a full set of teeth that are functioning on the same day.
Is that right? Now, how old can you be to get the procedure, to get new teeth?
Randy, I've done these procedures on people who are in their early 20s, and I believe my oldest patient was 96 who got this procedure done.
Why would a 96-year-old want to do this?
The same reason why the 20-year-old wanted to do it. He wanted to enjoy life. He wanted to smile. He wanted to eat. He wanted to taste his food better. So this 94-year-old comes in, frail man, walks slow, and, he would, whenever he spoke, he would kind of close his mouth, and you can just tell he was kind of shy, and he just looked like he wasn't able to eat properly, and he kind of thin and was losing weight. He heard about how we, do the procedures in one day, and that piqued his interest, so he came in. We went over, we did the consultation.
So was he wearing a denture or just had no teeth?
He was wearing a denture. He was wearing a very loose-fitting denture, and he couldn't even talk to me about his problem without this thing falling out of his mouth.
Okay.
And I myself was very curious as to why would a 94-year-old person want to do this procedure right now? And so I just asked him. I said, what's motivating you to do this? He straight up told me, I want to be able to eat. I want to enjoy my foods. I want to be able to kiss my wife. He would come in with his wife.
Nice.
Yeah.
And so at 94, I mean, statistically, they're not more likely to fall out?
Absolutely not.
So implants doesn't matter the age?
Nope. The way that the bone heals around an implant on a 20-year-old is going to be the same way it heals around an implant in a 95-year-old. On the day of the procedure, he comes in. He's nervous, of course, like everyone is. We gave him a tablet to take an hour before the procedure to relax him. We get him numb, local anesthesia, so he feels nothing during the procedure. Okay, I clean up the decayed teeth. I remove all the infection. I put my 4 implants in. And my team and I, we make him, his first set of teeth.
So 4 implants and a full arch of teeth goes on top of that.
So for him, we did 4 implants, and we made him a full set of teeth that are secured onto the 4 implants.
Okay.
And Randy, let me tell you, when we put those teeth in, my staff and I, we were like, wow, this, he looks like a 65-year-old now.
Okay.
Not a 95-year-old, but. What was really amazing was his own reaction. This was an older gentleman, just kind of very quiet and reserved. And, he looked in the mirror, his eyes just lit up. And he was just like, wow, like I cannot believe that these are my teeth. I have teeth that don't come in and out of my mouth. I've been wearing a denture for the past 50 years. And, just to see that transformation was amazing.
So 50 years he was in a denture?
He was wearing a denture for 50 years.
But isn't it true? I mean, if you've been wearing a denture that long, you don't have enough bone to do this.
That's not true at all.
Okay.
We can always find bone to place these implants. There's newer implants, there's longer implants that'll engage into bone in different parts of the mouth or a little bit higher up. So it's very, very it's not common at all that we would ever tell someone that you're not a candidate for dental implants. Yeah.
But some people, I think you told me on the phone, some people come in and they've been told elsewhere they don't have enough bone.
Oh, we see this all the time.
Where they're told they don't have enough bone to do it.
They've been told by the doctors who are comfortable with you need to do a bone graft, you need to wait 6 months, and by them they've been told that you need to have a bone graft and you can't do this procedure. But unfortunately they haven't been going to the providers who are well versed in all these different treatment modalities.
Okay, now let's talk about denture wearers, or the people that you can't save their teeth, have a full mouth of extractions. When they go in your office, what are their options? Because I guess there's snap in, snap out teeth, and you say you're not a fan of those. So why don't you run down what the options are for the lower jaw and the upper?
So the first place I think most doctors would start at is doing 2 implants in the lower jaw and making them a snap in and snap out denture. To me, that is not the way to go, because there's so many moving parts. There's a lot of maintenance. Those snaps, they when you take it on and off, they lose their connection. They lose the tightness. So, it may work great for a month or two, but then at the end of the day, when things become a little bit more loose, you're stuck with a denture. You're still stuck with teeth that come in and out of your mouth. You don't want that. I actually did it that way. And
like a lot of snap in, snap out stuff.
I would do the snap in and snap out. I thought I was doing a service for my patients, but after doing a number of snap in and snap out cases, and then doing a number of fixed cases, it's clear to me that fixed is the way to go.
It seems like that's what people want, right? Teeth that don't come out.
Who wouldn't want teeth that don't come in and out of their mouth?
And they can eat whatever they want, like this 94-year-old that you talked about earlier. I mean, if he wanted to eat a steak or broccoli or whatever he's strong enough to eat, he could eat.
He can go eat. Yep. He kept talking about how he wanted to go, and his daughter makes amazing tacos. Okay. And so he wanted to go. That was the first thing he wanted to eat was his daughter's tacos.
Did he eat them?
He did. And he came back in his follow-up and he told us about how much he loved them.
So what do they like more? Do they like the way their new teeth look, or do they like the fact that they can eat whatever they want now?
It's both. You have some people who come in and they just say, Doc, I just want to be able to eat and chew properly and function. And so we provide that for them. But then what we start to see with them is, they start to dress a little nicer, and they get a faster car, and they start talking to the front office girls a little bit more, and so it kind of opens them up, and they're starting to enjoy the other virtues of a beautiful smile. They're starting to enjoy the compliments that they get, And then we have another group of people who they come in and they don't like how their teeth look. They know it's kind of been holding them back, and they say, Doc, please give me back my smile. Like, I want to be able to smile again.
Okay.
And so we give them a beautiful smile, and very natural looking smile, and what we start to see with them is they start to look healthier. They're able to eat better. They're digesting their foods better. They come back and they tell us, hey, Doc, I went to my doctor, and my sugar's lower, my blood pressure's better, and I know that it's this one thing. I got my teeth done with you, and I'm just much healthier and happier now.
They can eat again.
They can eat. They can eat. They can enjoy life again.
You say for some people this is like changes their whole life.
Absolutely, yeah. This is a life-changing procedure. I had this one patient. He owned a food catering business, but for the past 10, 15 years, he was wearing a denture, and one of the things that bothered him the most was that he wasn't able to taste his foods properly. And, just imagine like not being able to eat and taste the food just because you can't, when you put your tongue on the roof of your mouth, you feel a piece of plastic,
That's terrible.
So we did this procedure on him, and, he told me that, he's eating better and he's enjoying his foods, and he actually told me that his business has doubled since he did this procedure.
Because of his teeth.
Exactly, yeah. I guess, maybe he's just more confident in presenting himself, and he's just out there in the world better.
You see a lot of people, they wait too long to do something. That means that they wait and wait, especially men, they wait until they're in pain before they actually come in.
Yeah, that's true. Unfortunately, that's true. For example, the 94-year-old patient who's wearing his denture for the past 50 years, he missed out, 50 years of enjoying his food, of being able to be kissing his wife and doing water sports and everything else that we all kind of take for granted when you have teeth that don't come in and out of your mouth.
Now you say, and we've talked about it in the green room, people hold on to their dentures too long. What do you mean by that?
They get their first set of dentures and then they just wear those for forever, and they'll buy their own glue and they'll just wear it, and they don't even know that they can come in and have a better denture made. let alone that all I need to do is put in about 4 implants and I can make them a full set of teeth that will never come in and out of their mouth.
So dental implants in one day.
That's what we're doing, Randy.
You do it all the time. Is this rare or you do it a lot?
No, we're doing this every single day. We have patients that come in at 8 o'clock in the morning.
No teeth?
No teeth at 8 o'clock in the morning. We get them numbed up, start the procedure. I put in my 4 implants, sometimes maybe 6. My team makes the teeth right there in the office on the same day. So usually between 1 and 2 o'clock in the afternoon, they're leaving with a full set of teeth.
Brand new teeth.
That don't come in and out of their mouth.
And they look good. They look real, because I feel like I could spot fake teeth walking down the street.
That's one of the things that we're known for, Randy, is we make teeth that look like teeth. The last thing that I want to do is give anyone a set of piano keys or fake looking teeth. Like we love natural, beautiful teeth. I want people to say, wow, you have a beautiful smile. I don't want people to ask, oh, where did you get your teeth done?
Because in Beverly Hills, you have an office in Beverly Hills and also one in Rancho Palos Verdes. Sometimes I see these veneers that are big and bulky. Is that in the hands of the dentist, or is that what people want? Or do you think it's a mistake made by the dentist to make fake looking teeth?
I think sometimes it is what people want, but I think it's the dentist's duty to say, hey, you know what, this might not be looking as natural as we can make it. And the dentist is the quarterback.
Okay.
In that type of situation, and he should inform the patients that, hey, we can make things look a little better.
Now, one of the things I want to ask you about dentures again, the upper denture, it has suction, so that's pretty good.
No, Randy, it's not, because who wants to put their tongue on the roof of their mouth and feel a bunch of plastic? How can you really taste food that way? You want to have a nice glass of wine and you want to enjoy a steak. You need when you put your tongue around your mouth, you want to feel skin. You want to have all those taste buds exposed.
So if the patients, like the 60 plus, 70 plus crowd, even people with a lot of money still have dentures. Was it the philosophy where they were removing teeth? 50, 60 years ago, they were more likely to remove teeth than they are today?
Unfortunately, that was the case. Back 40, 50 years ago, you have a toothache, you might get a root canal, but then the root canal will fail, and then all they were able to do is extract the tooth. And sometimes, people in their 20s or 30s would end up with dentures.
Is that right? Do you run it? Like you said, you had one patient 50 years in a denture.
Yeah.
That's got to be unusual, though.
We see it all the time. Yeah, unfortunately,
right?
we do see that.
So 10, 20 years in a denture is not that long compared to what you're used to dealing with.
We see it all the time, Randy. Another patient, 20, 25 years in a denture. She got my mailer and, teeth in a day. And so her and her husband come in, and they probably some of the biggest skeptics that I've met.
Okay.
They're just like, how is this possible? Why haven't I heard about this before? How come no one else has told me about this? And, I just had to kind of take it from step one. I tell them how the implants are, heal in a person's jawbone. I had to tell them why we only need to do 4 implants and we don't have to do bone grafting.
And 4 implants is for a full arch of teeth?
For the full set. Full set of teeth. Full set of teeth on either jaw. So,
okay.
And I took them step by step. And, by the time the consultation was over, they were just like, where do we sign up? How soon can you get this done?
They both did it? Like a husband and wife kind of a thing?
Husband and wife.
So they both had no teeth?
They both, the husband was about to lose his teeth. He was on his way to getting a denture.
Okay.
And the wife had the denture for about 25 years. And so they initially came in for the wife, but when the husband found out
when he heard the story on the consult.
Yeah, he was like, wait a minute. So I can skip the whole denture phase. I can just go straight to getting implants and
nice.
Fix teeth, and I don't have to wear a denture. He was just like, when is your next appointment? We want to do this right away.
Wow.
So, we did both of them, amazing couple, and now some of the happiest patients that we've had, and we get text messages from them. They're at a steakhouse and
is that right?
and enjoying their steak. They'll selfie like eating a steak and drinking their wine, and they go out dancing afterwards, and these are the transformations that we love to see, and it makes everything worth it for us.
Is this one of those things where they go, I should have done this years ago? I can't believe I didn't do this years ago.
That's the number one complaint that I get. I don't get any complaints about pain or discomfort or anything. It was just like, why didn't I do this before? I wish I had done this before.
So that married couple, she's in a denture for 20-something years. He's about to get a denture. So what do you do it like a week apart? They get their teeth together?
We did it, I think it was about 2 weeks apart. One of them wanted to make sure that they were, well enough to take care of the other person.
Okay.
And so we did one person at the beginning of the month, and then we did the husband second. We started a couple weeks afterwards. Yeah.
And then they text you what they're eating.
So these are the texts that I get. People are, I can go out and have a burger. I can bite into an apple. I can eat my steak.
So I know a couple of denture wearers, and they never seem to complain. Are you saying there's no such thing as a happy denture wearer?
Pretty much, Randy. I mean, let me tell you the life of a denture wearer. You're living with something that comes in and out of your mouth every day. You cannot laugh out loud. You're afraid this thing is going to fly out of your mouth.
Okay.
You can't be intimate with your partner. You can't eat the foods that you want to eat. You go to your doctor and they're telling you need to eat better. You need to get some more fiber. I mean, with a denture, teeth are moving around when you're chewing. Good luck with that, right? You're making endless trips to the drugstore to get denture glue, and everything you taste tastes like denture glue. So this is the life of a denture wearer, Randy, and it's not fun.
So getting implants, is this like the third set of teeth? Like
if you will, you're born with your baby teeth, and then you get your adult teeth. And unfortunately, some people outlive their adult teeth, and luckily we're able to give them their third set of teeth.
And they're permanent. I mean, they'll last as long as just like regular teeth if you take care of them.
If you take care of them, they will last for the rest of your life.
And you just come in for regular every 6-month appointments, things like that.
Same way same thing you would do if you had your own teeth. You brush and floss. You come in every 2-3 times a year for a checkup and a cleaning, and you move on with your life.
You say these people give you cards and thank yous and hugs and everything else?
Cards, thank yous, hugs, tears of joy, laughter, bringing in their family, we do patients who, one person in the family has a denture, but then they get their teeth done, then all of a sudden there's their aunt and then their grandmother, then they all start coming in. They're like, you know what, this works. We don't have to live with a denture anymore.
You brought some photos. What are we looking at?
Yeah. So here you are, Randy. This is an amazing transformation. Okay. This patient, he came in, teeth a mess, falling apart. Walked in, couldn't look at anyone in the eye, kind of covering his mouth, and we just very kind of depressed, really. But he knew that we can help him. So we got him in, we did the consultation immediately just to, I think what it was during the consultation was that we gave him hope. We gave him hope that, he doesn't have to live this way. But I can immediately start to see his eyes open, and I could see, the life inside of him starting to come out.
So these teeth that I'm looking at on this before, you could not save those?
I would not recommend saving these teeth. He would just spend time and money, and eventually he'd end up where we took him to, with a full arch of dental implants.
And he didn't want a denture. That's we should mention. People go to your practice because they don't want dentures.
He didn't want a denture.
Okay.
He didn't want to have teeth that come in and out of his mouth. He wanted teeth that are fixed, like his own teeth were when he was 18 years old.
So what did you do for him?
So he comes in, we get him numb, we remove all his failing teeth. I put in the 4 implants, and my team and I, we make him the full set of teeth that don't come in and out of his mouth. We pass him the mirror, and he's just blown away by how he looks. I mean, look at him.
Jeez.
He's
wow.
He looks 20 years younger for number one. He looks a lot more healthy, a lot more vibrant. Yeah, it's the same person, but if they both present for a job interview, or
one looks more sophisticated. Like if I didn't know these guys, it's the same guy, but one looks a little bit more refined, more sophisticated, just because of his teeth.
Yeah, there's numerous research articles. USA Today, teeth. When you have nice looking teeth, you're perceived as smarter, as healthier, and a smile is a lot more attractive than a pout.
Yeah, I mean, there's no doubt about it. He's more handsome in the after than he was in the before.
Absolutely.
And all you do
And
with
you know,
his
he's
teeth.
going to act more handsome also.
He's going to act handsome.
Exactly.
So they just, like, their confidence, like you see it
Confidence goes through the roof. They become who they've always wanted to be.
You know, I've seen some of these commercials where guys get their hair and all of a sudden they're running and hiking and swimming. It's the same thing with the teeth.
It's the same thing, Randy. Same
Because
thing
when you
with the
feel
teeth.
good about yourself, you're more, engaged with life, I guess.
Yeah, you want to go out and you want to enjoy life. There's nothing holding you back now.
Okay, good. So no more dentures.
For him, no more dentures.
Now, we have to mention, dental implants are not covered by Medicare, Medicaid. They're not covered, even with the best dental insurance. Doesn't cover it. So what's the answer?
So what people are doing, Randy, is, you know, they're financing the procedure. And, you know,
Really?
we have patients every week coming in for consultation. They go through the financing. I mean, you do have to have good credit, you know. But
Okay.
my team, you know, I have 2 people on my team that, you know, specifically what they're trained to do is to maximize your insurance benefits and also to secure proper lending for you.
So now there's no more excuses for this, because you could get it financed or whatever. So nobody should be. Is this the future of dentistry? Like 20 years or 50 years, the dentures as we know them today, which are attached to nothing. Like in the future, do you think you'll see it in your lifetime that everything will be fixed to something?
You know, I really hope that that's how things will be, because to me, seeing someone in a denture is like seeing someone in a wheelchair. And you have someone in a wheelchair and you're giving them the ability to walk again.
Okay.
You know, and for me, someone in a denture, I give them their teeth back. They're able to chew and smile and laugh and be intimate with their partner, and they can live their life again.
And do they tell you that? Like, do you hear stories? Because I always think it's just teeth, but it's more than just teeth.
No, it's their lives. This is the first day of their new life, Randy.
Getting new teeth.
Exactly.
Okay. So if somebody wants to learn more, they just go to your website, and you do all your own consults? Is that right? You have a free consultation?
We don't charge for consultations. We don't charge for imaging. You know, my job is to educate the public of what I have to offer and how I can help them.
Okay, good. And final message, somebody watching this, maybe they have their teeth are failing, they're headed to a denture, or they're currently wearing a denture, but for whatever reason they're still afraid. Maybe even they're skeptical. What do you say to them?
Just come into our office and talk to us. You know, we have a solution for you. We can help you. It's not painful. It's not a long, laborious process. You know, you'll be glad you did it, and your only regret is that you didn't do it earlier.
All right, good. I want to thank you for coming on the show. Great stuff.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you could help.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.